Okay, I'm going to verify. I'm going to verify the physician order for the for this patient, and I'm gonna need to insert an IV line. So I want to go ahead and wash my hands and knock on the patient's door. All right, good morning, Mr. Smith. My name is Stanley, and I will be your nurse for today. I will need to insert an IV line for you. Okay, could you go ahead and tell me your name and date of birth? Okay, and I verified the patient's name and date of birth. Okay, can you tell me, are you right-handed or are you left-handed? All right, so you're left-handed, so we're gonna use your right arm today. All right, Mr. Smith. So I'm gonna go ahead and prepare my equipment. So I'm gonna draw 3 millimeter of normal saline, okay, which I have here, and I'm gonna prime my INT. So I'm gonna attach my my syringe to my INT, and I'm going to prime, making sure there's no bubble. Okay. All right. Now I clamp. Okay. All right. So now I'm going to select the vein, which is going to be the most distal vein from on your non-dominant arm. I'm going to select this one. Okay, I'm checking for a soft and bouncy vein. Okay, and I'm gonna pick this one. All right, so what I want to do, I'm gonna go ahead and apply the tourniquet. 4 to 6 inches above my selected vein. Okay, I'm going to check for pulse. All right, I feel the pulse. So next, I want to go ahead and put on my gloves. Okay, 4 to 6 inches. So I want to make sure that's 4 to 6 inches above my selected vein. Making this a little bit tighter. Okay. All right. So I'm going to clean my selected vein in a circular motion. Okay. I'm gonna go ahead and get my stillet. I need to stabilize the vein by pulling the skin taut, and I'm gonna have my bevel up, and we're at a 15-degree angle. So I'm gonna go in. Mr. Smith, you're gonna feel a sharp stick, okay? So I'm gonna go ahead and go in at 15 degree. I'm going to observe for a flashback. All right, so now I'm going to loosen the skillet. First I want to release the tourniquet, and I'm going to loosen the skillet while I'm advancing the catheter. Okay, I observe the flashback. Okay. So I advance the catheter. Okay. Okay. Now I'm going to apply pressure 1 inch above the site, trying to stop the blood. Okay. Now I'm going to attach my INT. Okay. I attach my INT. Okay, now I'm going to verify for placement. I'm going to aspirate for blood return. Okay, first let me get and unclamp this. I'm going to aspirate for blood return, and I see some pretty nice blood coming. So now I'm going to push down my normal saline. Okay, now I'm going to clamp again. Okay, attach this one. All right. So I want to make sure this is all clean around. Okay. Okay. Now I'm going to apply my. I'm going to use my tape. I'm gonna tape my IV line. Okay. Now I'm going to apply my sterile transparent dressing. Okay, now I'm going to label my dressing. I'm gonna label. I'm gonna put down the time, date, the gauge, and the size of the needle. Okay, and then I'm gonna go document, and we're using the name, the time and date, insertion site, size and type of catheter, number of attempts, instruction given to the client, and the client response. Okay, that's it. Thank you.